This video addresses some common concerns of breastfeeding mothers about the return of their menstrual periods when they're breastfeeding. If you're breastfeeding your baby, your periods may not return for several months after childbirth. This is because the hormone that causes you to make milk, that is prolactin, also stops you from ovulating and having your period. If you're breastfeeding day and night, it could be up to a year or even two before your period returns. But if you're giving some other milk to your baby in addition, your periods may return as soon as 3 weeks after giving birth. Having said that, some women who are exclusively breastfeeding even get their periods a few weeks after giving birth, and you don't really need to worry. Many factors determine when your period will return when you're breastfeeding, and these include whether you're exclusively breastfeeding your baby or you're supplementing with formula, the way your body responds to hormone changes, and how often and how long your baby is breastfeeding. Even after they return, your periods could be irregular, especially if you're still producing milk. The duration of your period can also change. They could be late by a month or two. Your first period after you give birth could be heavier with blood clots and more cramping. When you start reducing the amount of time you spend breastfeeding, your periods should slowly start returning to their usual routine. Now, if your period has come back, it means that you're fertile again and that you could become pregnant even if you're still breastfeeding. So you must speak to your doctor about contraceptive methods while breastfeeding. Oh yes, you can definitely breastfeed. Sometimes when you get your period, you could have sore nipples, making the first few days of your period a tad uncomfortable for you. What you could do is try and breastfeed as frequently as possible with a proper latch. If you have a lot of discomfort, you can use paracetamol. And if it is extremely painful, just express breast milk and feed your baby. It's better to avoid using numbing creams for pain relief because these creams can numb your baby's mouth as well. The return of your period does not usually affect your milk supply too much, but sometimes menstruation can reduce your milk supply just before or during your period because of a decrease in prolactin levels. Don't worry. Milk supply will definitely improve as your hormones return to normal levels. At this time, like I said, you could have a little discomfort during nursing. And your baby may also nurse more frequently because of the reduction in supply. Now, if you're breastfeeding when you're having a period, sometimes you find that your baby does not really want to latch. And that's because of the change in the taste of breast milk. The chloride and sodium levels increase in milk during the period and the lactose levels go down. So the milk becomes less sweet than usual and is more salty. So your baby may be fussy, feed less due to difference in taste, or even refuse to nurse. But once the period is over, the nursing routine comes back to normal, so don't worry.